I mean, the increase in hospitalisation is not surprising as COVID-19 infections continue to rise, and that's according to Francois Venter, head of Ezintsha, a group of academics and health professionals at Wits University.
Well, it's close on 14,000 new cases recorded in the last 24 hours. Hospital admissions, by the way, we have to watch this carefully. They've increased by 422.
We are going to see a spike in hospitalizations. As I said, just the sheer force of infection. There's one estimate that as many as 30% of people in Gauteng are infected already. That's millions and millions of people with the virus. So as I said, you just need a tiny percentage of that to be sick enough to go to the hospital, to overwhelm the hospital system. So we are going to see people occupying hospital beds. Within that, we just need to be quite careful about, saying that we just need to keep an eye on how many people are dying, how many people are infected, how many people are, how long those people are spending in those beds, and how sick they actually are. So we're going to be paying a lot of attention to the force of that infection. How, are those people progressing to ICU? How long are they staying in those beds? Are they just staying there for 2 or 3 days while we keep an eye on them? All those things are going to be really important things to focus on in the next probably in the next 2 or 3 weeks. And if people are being just watched for 2 or 3 days and they go home, that's wonderful news. If they're progressing to ICU, that's not wonderful news, and that we're going to need to be very careful about.
But let's take a closer look now at those numbers. The country has recorded 13,992 new COVID cases in the last 24 hours.
Gauteng still remaining the hotspot. 6,711 new infections. It's followed then by KZN. There it is for you on the East Coast. 2,715 cases.
That's right. The Western Cape is on 1,464 new infections. And the rest of the provinces, including the Northwest, Eastern Cape and Mpumalanga, all remain under 1,000.
The positivity rate rising to 31%. Sadly, though, we are seeing still more people losing their lives, 11 more people losing their lives, but a lot of the acclaim for the low death rate has got to do with the vaccination rate as well in the country. So let's keep going with those vaccinations.
Now, the Progressive Health Forum has condemned attacks on scientists. It says the country's COVID-19 response will be compromised if scientists are made to live in fear for their lives.
Weekend newspaper reporting that many of our top COVID scientists are coming under fire on social media. I'm sure we've all seen this, with some, and this is going too far, some even receiving death threats.
Eastern Cape, of course, has been kind of a poster child for this dysfunction. Of course, the issue of running out of food, takes it to a new low. And it's really of great concern, especially in the midst of the pandemic. And one would have expected that would not be an issue given the amount of resources that have been pushed into that province following the onset of the pandemic. The gift of the givers have been doing this, helping out the Department of Health in various provinces. Recently, of course, our teaching hospitals in Johannesburg had no water, and neither the Department of Infrastructure or the Department of Health could do anything about it because they had no money and they had no management of this, and these people had to step in. It's an indictment on provincial management of health.